Stem cell therapy represents a frontier in modern medicine, a beacon of hope for the treatment of various diseases that have long eluded effective therapies. The unique properties of stem cells, particularly their ability to differentiate into various cell types and their potential for self-renewal, make them a powerful tool in regenerative medicine. As research continues to advance, the applications of stem cell therapy are becoming increasingly diverse, offering the promise of healing for conditions ranging from neurodegenerative diseases to injuries and even organ failure. One of the most compelling applications of stem cell therapy is in the treatment of neurodegenerative diseases such as Parkinson's disease and Alzheimer's disease. In these conditions, the progressive degeneration of neurons leads to severe cognitive and motor impairments. Stem cells offer the potential to replace lost or damaged neurons, potentially restoring function and improving the quality of life for patients. For instance, studies have shown that dopamine-producing neurons derived from stem cells can be transplanted into the brains of Parkinson's patients, leading to significant improvements in motor function. Similarly, research is ongoing into the use of stem cells to regenerate the damaged brain tissue in Alzheimer's patients, aiming to halt or even reverse cognitive decline. Another area where stem cell therapy shows great promise is in the treatment of cardiovascular diseases. Heart attacks and chronic heart failure can lead to significant loss of cardiac tissue, resulting in diminished heart function. Stem cells, particularly those derived from cardiac tissue or bone marrow, have been explored for their ability to regenerate heart muscle. Clinical trials have demonstrated that injecting stem cells into damaged heart tissue can lead to improved heart function and reduced symptoms of heart failure. This approach not only addresses the symptoms of heart disease, but also targets the underlying damage, potentially leading to long-term recovery. In addition to neurodegenerative and cardiovascular diseases, stem cell therapy is being investigated for its applications in treating autoimmune diseases. Conditions such as multiple sclerosis and rheumatoid arthritis involve the immune system attacking the body's own tissues, leading to inflammation and damage. Stem cell therapy aims to reset the immune system by using hematopoietic stem cells, which can be harvested from the patient's own bone marrow or peripheral blood. By reintroducing these stem cells after intensive immunosuppressive therapy, researchers hope to promote the regeneration of a healthy immune system, reducing the autoimmune response and alleviating symptoms. The potential of stem cell therapy extends to the field of orthopedics and sports medicine as well. Injuries to cartilage and musculoskeletal tissues often lead to chronic pain and disability. Stem cells can be used to regenerate damaged cartilage or bone, providing a more effective treatment than traditional methods, which often involve invasive surgeries or long recovery times. For instance, stem cells derived from adipose tissue have been shown to promote cartilage repair in osteoarthritis, potentially offering a non-surgical alternative for patients seeking relief from joint pain. Despite the remarkable potential of stem cell therapy, there are significant challenges that must be addressed before it can become a standard treatment option. One of the primary concerns is the ethical implications surrounding the use of embryonic stem cells, which are often harvested from human embryos. This has sparked intense debate and led to strict regulations in many countries. The focus has gradually shifted towards the use of adult stem cells and induced pluripotent stem cells, iPSCs, which can be generated from adult tissues and reprogrammed to an embryonic-like state. While this approach alleviates some ethical concerns, it still presents challenges in terms of efficiency and scalability for clinical applications. Another challenge is the risk of tumor formation. Since stem cells have the ability to proliferate indefinitely, there is a potential risk that they could give rise to tumors if not properly controlled. Ensuring the safety and efficacy of stem cell treatments is paramount, and ongoing research is focused on understanding the mechanisms that govern stem cell behavior and how to mitigate the risks associated with their use. This includes developing methods to precisely control differentiation and proliferation, as well as rigorous testing in clinical trials to monitor for adverse effects. Moreover, the variability in patient responses to stem cell therapy presents a significant hurdle. Factors such as age, genetic background, and the specific nature of the disease can all influence outcomes. Personalized medicine approaches, which tailor treatments to the individual characteristics of each patient, are being explored to enhance the effectiveness of stem cell therapies. This could involve using a patient's own stem cells, or carefully selecting donor cells that are most likely to succeed based on genetic compatibility and disease profile. Regulatory hurdles also pose a challenge to the widespread adoption of stem cell therapies. The approval process for new treatments is often lengthy and complex, requiring extensive clinical trials to demonstrate safety and efficacy. This can slow the pace of innovation and limit access to potentially life-saving therapies. Advocacy for streamlined regulatory pathways, while maintaining rigorous safety standards, is essential to bring these promising treatments to patients more quickly. In conclusion, stem cell therapy embodies the potential to transform the landscape of medicine, offering new hope for patients suffering from a range of debilitating diseases. From neurodegenerative disorders to cardiovascular diseases and beyond, the applications of stem cell therapy are vast and varied. However, the journey from laboratory research to clinical application is fraught with challenges, including ethical considerations, safety concerns, variability in patient responses, and regulatory complexities. As research continues to evolve and our understanding of stem cells deepens, the promise of regenerative medicine may soon become a reality, paving the way for innovative treatments that can restore health and improve lives. The future of stem cell therapy holds great potential, and with continued investment in research and development, it may one day fulfill its promise as a cornerstone of modern medical practice.